November is Lung Cancer Awareness Month, and every year there are nearly 47,000 new cases in the UK, which makes it the third most common cancer. And there are some things about this disease which might surprise people, including the fact it can affect anyone, young or old, and whether or not they've ever smoked, they can also fall foul of this disease. Well, to raise awareness on the island this week, there are various things happening, including the Tower of Refuge going blue tonight. I think the Ramsey Swing Bridge is as well, and the power station too. To tell us more, we're joined by Sandy Denning from the Isle of Man Anti-Cancer Association. Melody Holt is from the Roy Castle Lung Cancer Foundation's Information Support Team. Hope I got that right, Melody. That's a mouthful, isn't it?
Course, yeah, it's a long name.
And Heather Christian is a Manx patient who was diagnosed with lung cancer a couple of years ago. And let's come to you first of all, Heather. At what point did you realise that there might be something wrong?
Well, actually, it was back in December 2015. I was experiencing back pain, and that became exacerbated following a minor fall in January 2016. I attended my GP surgery and was diagnosed as having pulled intercostal muscles with referred back pain, and initially given painkillers and then anti-inflammatory and muscle relaxant medication. However, that worked for a couple of weeks, but then at the end of the course the pain was back with a vengeance. I couldn't stand up, sit down, walk up the stairs, even carry my handbag without being in a lot of pain. So I attended a local A&E, got checked over. They thought the bottom of my right lung sounded a little quiet, had an x-ray, and that showed a shadow there, and I was told it could either be an infection or a tumour. So I was given antibiotics, had a follow-up x-ray. A couple of weeks later, there was no change in my symptoms in that time, or indeed the x-ray, and a CT scan then revealed that I actually had a tumour at the base of my right lung, which has gone through 2 lymph nodes into my spine and onto my right hip, so the cancer had progressed. So for me, although it was treatable, that was clearly with sort of palliative care intent rather than curative intent. And I had a subsequent MRI scan which revealed that the cause of all this horrendous back pain was impending spinal cord compression, and I was rushed off by air ambulance to Clatterbridge the same day and had 7 days emergency radiotherapy treatment there. So since then I've had chemotherapy when I came back, tolerated that not too badly for a little while, but then I got to the situation where I'd have the treatment. It was a 3-week cycle, so I have a treatment on Thursday. By Monday or Tuesday I'd be in hospital, in for 10 or 11 days and out to start the whole cycle again. So before the cancer could kill me, I think the treatment at that point was going to. However, it had reduced the tumour in my lung, so I had a good year really, with only having some injections to help protect my bones. And then in October 2017 I had a nodule showing on my 3-monthly CT scan, had that checked out in a PET scan. That confirmed the nodule was simply dead tissue. However, it did show that I had disease progression in my spine. So I had a further blast of radiotherapy back then, returned to the island, and luckily for me, in the time since I've been diagnosed, immunotherapy has actually been approved, and I was able to commence immunotherapy, which again is given intravenously every 3 weeks, after 2 weeks coming back. Unfortunately, I've managed to tolerate that quite a bit better. So I do still have my 3-monthly sort of CT scans and then a follow-up appointment with the oncologist. I had my last one last week, my CT scan, and I see the oncologist tomorrow. So this is always a slightly tense time, to say the least. But I have to say that for me, I never thought lung cancer couldn't happen to me. I thought it could not lung cancer, cancer couldn't happen to me. I thought cancer could happen to me as easily as it could happen to anybody else. And indeed, I would go for regular smear tests at 50. I entered the breast screening programme with a family history of bowel cancer. I'd also entered a screening programme for that. So I was trying to sort of do what I could. But I must admit that I never actually thought of lung cancer. And so that really, really did shock me. I didn't have a persistent cough. I wasn't hoarse. I didn't have shortness of breath. I wasn't spitting up blood. I hadn't unexplained weight loss. The only symptom actually that I had on reflection was an extreme fatigue, and that really was sort of quite debilitating. But I had a very, very busy lifestyle, had done for years, and I thought it was simply catching up with me. And so I didn't even mention that to the doctor. And hence, I'm not at all surprised that I wasn't diagnosed sooner. But I am, I've been really impressed with the care that I've received sort of since Nobles Hospital, Clatterbridge, Isle of Man Hospice. There's a great team up at the oncology clinic. They're absolutely fantastic. And I think I've been very lucky. I'm very fortunate. I've got a wonderful husband who's been by my side throughout, fantastic family who couldn't do more, and great friends who, they really have been unfailingly supportive and encouraging. And, to me, I would sort of say to, obviously, if you have any of those symptoms, please go to your doctor and get advice as soon as possible. And, if there's anybody out there that perhaps has just had news like I had going back then, I mean, my prognosis in February 2016 was 9 months, and for today I'm vertical and ventilated. Goodness knows what I'll be told tomorrow, but hey, you just have to hope for the best. And I just think life does go on. It's different. There's a sense of loss over things you can no longer do, but there's an awful lot that you can still enjoy. And for me, my sort of personal sort of strategy or whatever is to put on my lipstick, a smile, and travel hopefully.
I tell you what, Heather, you are an absolute inspiration, but you really do highlight what I mentioned in the introduction, the fact that there are some myths surrounding lung cancer. I mean, you were incredibly young to be diagnosed with what you were, and also you'd never smoked either.
I'd never smoked. No. In fact, for most of my adult life, I had a really keen interest in health and nutrition. I tried to eat healthily. I exercise regularly. So, since being diagnosed, I've tried to eat even more healthily than before, actually, and do what I'm told, which I have to say doesn't come easily.